What's the word, y'all? It's Double R, the God, tapping in with y'all, man. This is the 13th episode of the God Pod. Today, we actually have our first doctor on the show. This man has not only helped restore my back pain, but he's performed over 200,000 adjustments in the span of his career, helping people relieve their back pain as well. Hold on, one more time. You can keep it going, though. You keep going. All right, you ready? What's the word, y'all? It's Double R, the God, tapping in with y'all, man. This is the 13th episode of the God Pod. Today, we have our very first doctor on the show. This man has helped me restore my back pain after a crazy deadlift injury. He's also performed over 200,000 adjustments over the 30-year span of his career, helping people relieve their pain. He's helped fix their bodies as well as improve their overall performance. Today, we're going to be talking about the common misconceptions in regards to chiropractic care, as well as some of the things that you can do to help fix your own back, whether that be at home, and just some of the wildest cases that he's seen throughout his career. With no further ado, Dr. Grant Schneider. How you doing today, brother?
Good evening. Thanks for having me on.
No problem. So, in regards to your career, what was it that initially got you into wanting to do chiropractic health? Was this something that you've always wanted to do as a child, or was it something that you figure out later on throughout school?
See, I was doing pre-dental or pre-med, so the coursework is the same. So I was in undergrad doing those classes. And at the last minute, I made a change to chiropractic. I thought it'd fit me better than dentistry.
Okay. What exactly is a chiropractor for those who don't know?
All right, so mainly we're in charge of care of the spine, the neck, and the back. We also work on all the other joints in the body, hips, knees, ankles, wrists, shoulders, and then just the general care of the frame of the body. A bit like a dentist. So the dentist looks for problems, takes care of those problems, but also screens and maintains their patients. And that's the same idea that we have. We want to maintain your frame and not only fix problems, but prevent problems.
What are some of the most common injuries that you've seen throughout your practice?
You know, just the whole gamut. People are always falling on the ice. People are always falling on the stairs. Those are real common. Just this week, an older lady tripped in the garage and hit the concrete. We see a lot of teenagers, so we see a lot of swimmers. We see a lot of hockey players, a lot of football players, gymnastics, cheer, and well, all of those have risks, but we see a lot of injuries in cheer. We see a lot of injuries in gymnastics, of course, football and hockey.
So really having to do like with a lot of performance stuff, athletic things.
Yes and no. So people get hurt; they don't want to hurt anymore. But then some of these elite teenage athletes, the parents are driving them out of state, and they're on travel teams. And they're really investing a lot of time and money into the sport, hoping that, the child can go on and play in college or maybe even further. And so they're looking for an edge. And so oftentimes the parents are bringing their athletes in to the chiropractor just to get that edge, to make sure that their kids are performing at the highest level possible.
So are you seeing more people come in, and like in that regard, are you seeing more athletes come in before to perform better or after they've gotten injured? Both. What are some of the common things that people are doing in their day-to-day lives that they might not know is causing them to wind up in the chiropractor, so to speak?
Gotcha. I just back up 1 second. We had a swimmer that needed to drop just a couple hundredths of a second to make the state team, and she made it.
Wow.
And so that's why the parents were bringing her, and she made it just at the last within the last week that she qualified.
That's crazy.
Let's see. People sit a lot, so computers are prevalent. People are sitting at the desk a lot, and so all of those hours of sitting is hard on the low back, and then all of those hours of looking at a monitor, it's hard on the neck. People are looking at their cell phones all day long. They're looking down. They're aggravating their necks. Let's see. There's a lot of people, there's more people go to the gym than you would think. It surprises me. And people do hurt themselves at the gym. Let's see, people often have trouble with elliptical machines.
Mm.
That's one of the machines that brings me a lot of business.
Wow.
So people are better off on a treadmill. They're better off on a bike. They're better off on a Stairmaster than they are on an elliptical. Let's see, just people are powerlifting, and they're hurting themselves. So, and then you have hardworking folks, so you have people working on the line with the big three. You have, people that are doing construction. You have people that own their own companies and they're carrying, multiple sheets of drywall when they should have somebody else helping. So just all day long, there's people from all walks of life coming in. And having issues and getting them taken care of.
What are some things that chiropractic care can heal, like other parts of the bodies that maybe may not directly go with the adjustment? Like, let's just say you might be fixing someone's back, or just the overall health. What other parts of the body is it healing that people might not expect?
Gotcha. Let's see. Caring for the spine is also caring for the nervous system. So the spine is the home for your central nervous system outside of the brain. So issues with the spine can cause neurological issues. So an easy one to understand is if you got a problem with your low back, oftentimes you get sciatica. You get this pain in your leg. There's nothing wrong with your leg, but it's hurting anyway.
Right.
The cause of the problem is in the spine, and you're feeling it along that neural pathway and experiencing pain in the leg, but there's nothing wrong with the leg. All right, what if that nerve goes to your digestive system? So we can be overstimulating the stomach and overproducing acid. In time, we can have a neurological issue where there's decline in the health of the neurology, and so now we're understimulating the target organ. So we're certainly not saying that we have the answer to all health problems, but caring for your spine can also improve overall function.
What's one of the biggest myths that you've heard in regards to chiropractic care?
Biggest myth, holy mackerel. I think it's interesting that we've kind of gotten put into this ache and pain doctor kind of thing. And I think we would like to be thought of, again, more like a dentist. So that if you care for your spine and you maintain your spine and you're not just coming in when you're hurting, then you don't have to have a lot of these degenerative things. So people work their whole lives, then they retire, and then they're hunched over, with this, really curvy low back and this anterior or forward head carriage, and they can't enjoy their retirement because they didn't take care of their spine throughout their life. So in the same way that you want to maintain your teeth, you want to maintain your spine, you want to take care of your neck, you want to take care of your back, so you can have as much longevity, as much function, and as much comfort as possible throughout your life. So I think chiropractors in general, we of course are happy to take care of sore necks and sore backs. We would also like to prevent problems. We'd also like to improve function. We also like to improve comfort. We also want to improve range of motion. It's just funny before backup cameras how much trouble people would have just turning their head to back up the car. And so even after a couple visits, people are commenting, geez, my head turns so much better. My neck is so much freer. So just maybe the category that we get put in, I think, would be a misconception.
Do you think that social media has helped with chiropractic care, or do you think it's worsened it?
I think it's helped. More exposure. I don't think there's no such thing as bad exposure, right?
Right.
So, once more people are talking about your profession, then now they're coming in, they're asking questions, and if they have some misconceptions, well, then I can clear it up. So I'd rather have people talking about the profession than not.
Now, a lot of people crack their own back and crack their own neck. What are the dangers to that, and is it okay to do that sometimes?
Gotcha.
Or
Let's see, when I'm working on an individual, I am trying to make a very specific correction. And it's really hard to tell as a patient, but the chiropractor's arm is on a very specific vector, a very specific angle, moving in a very specific direction to make a very specific correction. When patients are crunching their own neck and back, they're doing random things to their neck and their back. And so it is possible that those random things could be helpful, but you could also be moving things, in a bad direction. So it's 50-50. You could make yourself better. You could make yourself worse. You're better off to let somebody who knows what they're doing do the work.
How do you feel like chiropractic care compares to like regular medicine? Like
Well,
the
if I had a heart attack, I wouldn't go to a chiropractor. Um, you know, uh, Medical doctors, they have their place and they do a great job with what they do. Um, However, they kind of sometimes cross over into our turf, and we don't think they do as good a job. So there, it's less now after the opioid crisis, but
we,
earlier on, they were just overprescribing these medications. And so here's your muscle relaxer, here's your opioid. Um, Hopefully you'll feel better in a few weeks. And so we're kind of masking and covering things up as opposed to getting at the root cause. Um, so y- you know we don't need to be on the medical doctor's turf. We'd rather that they weren't on our turf. Everybody's got a place. Everybody's a good doctor and should be respected.
in regards to your clients, what has been their overall observation in regards to their stress and anxiety, like the levels of it,
In their own daily life, or you're talking about stress about seeing the chiropractor?
like in their own daily life?
Gotcha. Um, let's see. People are just stressed out of their mind these days. So I I see how computers are helpful. You can take on a larger volume of work, but now we've kind of become a slave to these things. You used to be able to call a company and they would take your name, your address, and they would enroll you in whatever you wanted to get done. Well, now you got to go online, you got to do it yourself, you got to download the app, you got to do all the work that the customer service rep used to do. And so email has turned into this big dumping ground. It's almost I perspire sometimes when I open an email and, look at the volume of things that I have to, consider and address. Um, and it's also become, a little bit lonelier because you're on the computer, it's just you and that screen as opposed to, that, team building and that teamwork kind of thing. And then it's just a busy, busy world out there. And then you throw a little bit of politics on top of uh, all the work stress that we have, and people are stressed out.
Do you believe that trauma is stored in the body, and do you believe that adjustments help relieve that trauma?
Oh, yeah. So um, trauma and stress are kind of similar. Um, Both produce cortisol. And so that's a stress hormone that your body releases. And it makes for achy joints. It makes you feel uneasy. It makes it so you lose sleep. So, yes, all the things that happen to you, all the little traumas, all the little stresses in your life tend to hang around. Let's see. I certainly can't solve, everybody's stress in their life. I'm not going to make their boss a nicer boss. I'm not going to lighten their workload. Um, but feeling more comfortable, being able to, have the range of motion that you want, being able to pick a pencil up off the floor, back the car out of the driveway, pick up your grandchild, those things, are really helpful and can help to reduce people's stress.
So, what is the sound of your neck cracking or your back cracking in an adjustment?
Gotcha. You know, some say that there's a little error in the joint. Uh, all of the joints in the spine are synovial joints. Synovial joints means that there's a bag called a bursa and there's fluid in there. So all joints in the spine have this fluid filled bag. And when you move the joints, that fluid is sloshed around and makes that noise. So, you, in my opinion, you don't have air in the joints.
Okay. Um, I've heard that bad posture can actually reduce your lifespan. Do you believe that's true?
I don't know. That sounds dramatic. It's not a good idea. It You certainly see, a lot of older women in particular, as they lose some of their bone density, if they have that poor posture, then they start to get compression fractures and they start to get that real round upper back and their head is pushed forward. Um, and I would imagine if, you're forced into that position that life is going to be less comfortable. I'm not sure you'd have a shorter life. I'm not sure.
So it's more so probably like a culmination of the things of, having bad posture, all the other things that it could affect throughout the body.
Yeah, absolutely.
What are some of the overlooked things that are injuring people's spine, like some of the more common things?
At work, most people have their desk chair too low. So just raising your desk chair an inch can really make a difference. So
Mm.
when you raise your desk chair an inch, your shoulders aren't like this, and then you can let your shoulders relax and you can let your arms drop further. And so that you're not in that stressed position. So now you're in a more relaxed position. So that really helps with reducing neck and upper back pain and helping maintain your posture. Let's see. A lot of people are driving a lot, and they're not taking the time to get out and stretch a little bit. They're not taking full benefit out of their power seats. It can be real helpful to lean your seat back a little bit and then bring the front of it up a little bit so that um, there's less pressure and less stress on your low back. So in general, sitting is the most detrimental to your low back.
Mm. Is it the lower back that you see the most common injuries with?
I'd say it's 50-50. I see as many neck people as low back people.
Mm.
But again, every day, more and more people are realizing that chiropractors can, work on hips and shoulders and knees and ankles. So every single day, I, work on a hip, a knee, an ankle, a wrist, a shoulder, and I'm working on necks and low backs. And, I'd say most of the time, if somebody's got a neck issue, they got a low back issue as well.
Now, for somebody who may be not experiencing back pain or neck pain, or might be like, I'm fine, I don't need to go into the chiropractor. What's a general adjustment that could help them, like just to help them improve overall?
But see, symptoms don't show up until you've had a problem for a while. And so people assume that whatever's hurting began last week or began last month. But you had something that wasn't quite right, and then you finally had that last straw.
Mm.
So it could be lifting groceries or what have you. So again, more and more parents are bringing their kids in. And so at 15, maybe you've got a kid who is pain-free that day. And then when you look at them under X-ray, they
Right.
got a lot of issues. And so again, more and more parents that light bulb is going on for them. They're going, oh, a lot of the stuff I'm experiencing actually began when I was doing all that dumb stuff when I was a kid and a teenager, but I could shake it off because I was young.
Right.
And so just life is hard. We all got to learn about ice. We all got to learn about the stairs. And, boys in particular, we all got to jump off the garage once or twice. They're just all the things that,
Yeah.
add up as you go through, childhood and your teenage years, can cause problems later.
I would definitely say that going into the chiropractor, or if you don't feel like you need anything adjusted, to at least go get your spine looked at. Because I remember going to see, when I first came to see you, the two lower, I don't know the exact word for it, but the bridges of my spine, I would say like the L3 or L4 or something like that, were actually connected together and fused together. So I actually don't have as much flexibility in my back as the average person because those two bones are fused. And then just being able to see how straight your back actually is. Not a lot of people would think that their back is crooked, or, it might have a curve to it. But when you see it on the x-ray, it really gives you a good glimpse of what's going on. What is the most pain you've seen somebody in, like before they had an adjustment?
And just, excruciating, I've seen men in tears. I see women in tears a lot. If you've got a bit of a disc bulge and it's putting some pressure on a nerve root or on the spinal cord, it hurts. Um, it, Women compare it to childbirth, that it is that intense. I've heard them say that this is worse than childbirth.
Wow.
And then, just speaking to that, if you're ever that bad, definitely don't want to do any heat. So if you got something fresh and that's that hot and that irritated, you got a bunch of swelling. So the heat can feel good, but it amplifies the swelling, so you pay for it later.
Mm.
You definitely want to be icing anything that's that painful.
You said you definitely want to be icing.
Yeah, you want to get that swelling down, and ice will help.
If you can think of any, what's one moment that's like really changed your perspective on chiropractic care throughout your career?
You know, I get thank you cards. People saying how much it's made a difference for them and how grateful that they were. Um, Seeing a patient come in who's already been through a lot. They've been to the orthopedic. They've had steroid injections. They've went to urgent care and got pain med injections. Um, Oftentimes, I'll see people Monday morning, and they went to the emergency room over the weekend, um, and they've tried so many things. And then when it works out in my office, they're grateful, and so it's just nice to see something work out for somebody, and for them to feel a little bit of peace, yeah, about that particular issue, so that because it's typically front of mind, and it interferes with all of the rest of their thoughts because that pain is just there.
Now, what's one of the like weirdest situations you've seen, like that may be an injury or somebody may be complaining that's bothering them that was actually linked to their spine?
Let's see. It's it's something that just kind of happens over time. So, for example, a lot of people are taking something for digestion, some kind of acid controller. And so your mid back, T6, T7, so that's your thoracics, and that's the really the mid portion of your back. The neurology from that part of the spine goes to the stomach. And so it's often that patient, their stomach is overproducing acid, so they're having to take an acid controller. So just seeing them being able to wean themselves off that over time has been real nice. Being able to see people wean themselves off of a bunch of Tylenol daily, or some other pain medication. Let's see. Migraines are really intense for some people.
Mm.
I mean, it's just debilitating. And to make some progress with a migraine patient is really cool and really satisfying.
Yeah, I could believe that because I'm sure it's a lot of things that are linked to your spine that most people wouldn't assume is in correlation with chiropractic care. Um, Not assuming that not every chiropractor is great. Are there any red flags that you can think of when it comes to, yeah, you probably shouldn't deal with this chiropractor?
Let's see. It's more of a patient preference kind of thing. So I may not necessarily be 100% behind this fibromyalgia diagnosis, but there certainly are a number of people that if you touch their shoulders, it's extremely painful for them. Let alone giving them any treatment. Just poking around is very painful. Um, so that type of patient prefers gentle care. Uh, so I think there's some patients that would be better off in a gentle care setting. Um, I'm more of a frame straightener, old school chiropractor, and I can provide gentle care, but I would say that patients should seek out a chiropractor who's a fit for them. Um, let's see, all chiropractors are licensed. They all have to pass, a very difficult board exam. We have the same amount of education and classes that MDs do. We just get more in anatomy, and they get more in pharmacology. So everybody who's got the degree, is a pretty together person. And then so when it comes to red flags, it'd be the same red flag that you would consider in any profession. That dude just doesn't seem right.
Right, right.
But other than that, um, different chiropractors practice differently. Some gentle, some rough, different techniques, those kinds of things. And there's really nothing wrong with any of it.
Is there any new technology that you've seen or that you use that you feel like has improved chiropractic care?
Let's see. I'm not into a lot of devices and those kinds of things. I don't do like muscle stim or ultrasound in my office. I don't do lasers. Some chiropractors are having some pretty good luck with the laser stuff.
What's the laser stuff?
So it's mainly for deep pain in a joint. So you got deep pain in your knee or in your shoulder. They're using what they call a cold laser. And don't ask me about the science behind it because I haven't done the research on it. But for me, in my practice, the thing that the piece of technology that has been the most helpful was switching from regular plain film X-ray to digital. Um, so I'm getting a much clearer picture. The data isn't stored in some envelope in the closet. It's right there, and I can, with the touch of a button, while the patient's in the room, I can look at any of the views that I've taken immediately. And so if a patient goes, why is my neck hurting again? I can bring up that side view of their neck and show them, okay, you got a mess here, you got a lot of arthritis here, you've got these issues there. And also, it's clearer, more precise, and I've really enjoyed the switch. I resisted it for a long time, just because I'm a little bit older and, you know, change, is not my middle name. I'll tell you that for sure. But I am happy that I did make the switch.
That's awesome. Is there any no point of return when it comes to adjustments where it's like there's nothing that I can do here anymore? You might have to get surgery or anything, something like that.
All right, so there's something called a 30-day rule in healthcare. You got 30 days to get your patient at least 50% better, or you got to do something different. So you either, at the end of 30 days, got to change your treatment or order a test like an MRI, or you got to refer them to somebody else. So, I do have to have these talks occasionally. And I had a talk with a patient today. They're just not progressing satisfactorily. We discussed some things that we could change in the office, but I also suggested that they make an appointment with their primary. Let's get another opinion. Let's have somebody else look at this. So it is, are they making progress or not? And pretty much all of healthcare is on board with that. Like, for example, if you want to order an MRI through Blue Cross. So if I'm going to order an MRI for the patient, they're going to ask me first, how long have you been treating the patient? Have you given them a month of conservative care? How many visits have they had? And if they're not making progress and there's been 30 days worth of care, then they'll approve the MRI. But if I've only been working on them for a week, they're going to say, sorry, pal, you got to give it a real shot here before we're going to authorize this MRI.
Is there generally a specific part of the body that you run into that more often than others? Like, is it the neck or is the lower back, upper back?
It's either neck or low back, very, very rarely the mid back. And it's just because those are some busy parts of the spine. You don't do that much with your mid back. You're not bending, twisting, and lifting. You're mainly bending and lifting with your low back. And then, your neck, your head's on a swivel and it's carrying a lot of weight. Your head is pretty heavy. So, your neck works hard, your low back works hard.
Now, there's a myth that once you start going to the chiropractor, you can't stop. You have to keep going. Will you speak on that a little bit?
Let's see. There's no arm twisting in chiropractic. It's the same as a dentist. You can go to the dentist when you feel pain or you feel like you got a hole in your tooth. So you can use a dentist however you want. You can go, wait for 3 years or 5 years until you got a problem. Or you can get some regular checkups, some cleaning, and some maintenance. So a patient that comes to me, of course, I would rather that they, after things got fixed, I would rather that they, took care of themselves with some type of maintenance. But if once the pain is gone, if they would rather, take off and, wait, that's fine too. We don't twist anybody's arm. But I would say most of those people, they're back within about a year and, okay, I do needed some help again. So I have all categories of patients. I have some patients that have been with me since I bought this office in 2011. They've been coming since then. I have some other patients that I'll see 3 times, and on the third visit, they feel like they're fine, and I don't see them anymore. And then I see everything in between.
Now you spoke on it before a little bit, but how exactly do stress and emotions play on the body?
Again, if you just give somebody like an upper back rub or you touch their upper back, you come up behind them, you put your thumbs on their upper back. A lot of people are either going to say, "Ouch, ouch, that hurts," or "Oh my God, don't stop." So people just carry so much stress, and it's really evident and obvious just below your neck across the top of your upper back, not quite in the true shoulder joint, but just up on the top. Um, and help me out again. Where were we going with this question?
As far as stress and emotion, like how does that play?
Okay. So yeah, it's really evident in people's posture and just their comfort level in their upper back, and you can see people. A lot of people are just they're just like this. They're just their shoulders are in their ears
Yeah.
because they're so stressed. But then again, cortisol makes swelling. Cortisol makes you puffy. Cortisol makes your joints sore and achy, and cortisol is released by the body in response to stress.
Now, if you know off the top of your head, what is like the percentage of, like, for people, those people who are scared, what is like the percentage of adjustments that go wrong where people's neck break or something like that? Because I feel like people might not understand exactly the level in between that.
Gotcha. There's always been this funny thing between MDs and chiropractors. We believe that the MDs have, kind of harped on this concern about neck adjusting and made the public afraid of it. Um, but I would tell you, my malpractice insurance is about 4 grand a year, and theirs is about 80 grand a year. And the reason why is chiropractors ain't hurting many people.
Right, right.
Let's see. If you got somebody who's been around for a while, so this is my 32nd year, So again, now I'm over 250,000 adjustments. So just somebody who's experienced and has the touch and has the feel, I think, you know, is gonna have better odds of a patient not leaving sore. And then the big incidents are few and far between. You're much more likely to have a serious health issue from taking Tylenol than you are having a serious health issue from seeing a chiropractor.
I agree. Is there kind of like a battle between MDs and the chiropractic world? Because I feel like chiropractic care more so falls in like the holistic almost area more than it does like traditional doctors.
It there is to some degree. Healthcare is a business, and so maybe the medical doctors would like to keep that piece of turf, that we feel that we own. Um, let's see. One thing that's nice is that chiropractors have been designated as primary healthcare providers. So that means we don't need a referral from nobody. There are a couple insurances that they're set up that way that the primary has to give a referral. But in order for us to have a patient come into our office, they can just walk in right off the street. They don't need to have a referral from anybody. Um, and I think that maybe the medical doctors would prefer that uh, that we would need to have that referral. They would rather be the gatekeeper of whether or not somebody gets to see a chiropractor. So I think that bothers them a little bit. Um, but every year that goes by, some of the old school, the old guard, they're retiring and going away, and the new blood coming into medicine, I don't think is as biased. There have been some bias issues.
Definitely. If you can give the people some advice in regards to health, chiropractic health, what's one piece of advice you would give them that they should follow every day?
Let's see. I do demonstrate a stretch in the office. It would be kind of hard to show here, but you gotta bend the joints in your body. So if the joints in the body don't bend, they will adhere over time. So but that's what happens when you hear about somebody talking about an adhesion. And so now the joint is hung up, and then the less the joint is moved by the patient, or the less that the joint is able to move due to an adhesion, it's not receiving nourishment, it's not moving waste products out. And so that's where arthritis comes from, is lack of motion and irritation within the joint. So you got to move. You got to do some kind of stretch. You shouldn't be sitting in your desk chair, for every minute up until lunch, and then right back in the chair until it's quitting time. You got to get up. You got to move around a little bit.
Definitely. Well, this has been a great interview, Dr. Grant. I really appreciate you having you on here. Is there what if you could leave the people with something inspiring or something motivating for the people, what would you tell them?
That maybe we should all be a little bit more open-minded. I think it is interesting when I have a patient come in who was, kind of had their own biases wherever they came from about chiropractic. And then they leave after that first visit with such a big smile on their face. And maybe if everybody was just a little bit more open-minded and stick their toe in the pool and test the water, that maybe we could take care of ourselves a little bit better.
Absolutely. I agree. Well, there you guys have it, man. That is the 13th episode of the God Pod. I hope you guys enjoyed it. Dr. Grant, actually leave them with where they can contact you, where they can find you. And yeah.
All right. Well, I'm Dr. Grant Schneider. My practice is Arbor Crossing Chiropractic Life Center. I'm in the southwest corner of Livonia, 37625 Ann Arbor Road. And again, that's in Livonia. I could do a phone number, I guess, 734-462-2262.
Do you have Instagram, TikTok, or anything for your practice?
No, I don't. I do have a nice website, though.
Okay, you can drop your website, too.
Let's see. I believe that's Arbor Crossing Chiro. I'd have to check it.
Okay, well, once you figure it out, just send it to me. I'll put it on the screen for the people to see.
Cool.
But yeah, appreciate you guys. That's the 13th episode of the God Pod. See you next time. Peace.
Yeah, I really got this shit in the bag right now. Bad bitch in the front seat, car go fast right now. Smoke dope, but we low key though. Had to give him the okey doke. Like I'm so straight, I'ma just pass right now. Nigga need that bread like Peter. Everything I do for a reason. If you break that code, it's treason. Every one of my dogs, I'm bleeding. Every one of my dogs, I need them. Locked down, free that pen, not breathing. I do this shit for a reason. I don't do this shit for no reason. What you wanna know, I won't lie.